Hi, I'm Dr. Brittany Todd with Sacred Heart Clinical Pharmacy Specialties, and this is the next part of the birth control talk. So if you haven't heard the first part, I do recommend you listen to the history of birth control before we get to this part. So this is the second part that talks about what is birth control. Birth control is a big encompassing term for anything that prevents pregnancy. Like I said in the other video, pregnancy has changed in its definition over time depending on where society has an acceptable level for birth control. So birth control can range from anywhere from barrier methods, that would be a condom, that would be a diaphragm, anything that prevents sperm and egg meeting, that's the barrier method. Some IUDs, intrauterine devices, are barrier methods. It can also be toxins. So if you use a spermicide, it kills the sperm because it's toxic to sperm. So that's a birth control. Another birth control would be sterilization, right? You get a vasectomy or you get your tubes tied, a tubal ligation, and you physically can't get sperm or egg out of the tubes to get to each other. That would be sterilization. And then the last and most common is hormonal contraception. Hormonal contraception is where you use hormones like estrogen and or progesterone, and they either inhibit ovulation, sperm movement, or they make the uterus hostile. So I like to focus on the hormonal contraceptives because as a pharmacist, the medications make the most sense to me. I'm trying to educate people about these medications. So hormonal contraception works by inhibiting ovulation, and then if that doesn't work all the time, which it doesn't, and you do happen to fertilize an egg, the progesterone comes in and says your uterus is hostile. So if you have a fertilized new zygote coming down the fallopian tube into the uterus, it has nowhere to go. It dies. It doesn't have a cushy pillow to implant inside of. So there are three mechanisms of birth control, hormonal contraceptives. They come in oral, they come in intramuscular injections, they come in vaginal rings and patches. There's just different ways to take it. They're all in one hormonal contraceptive. If it has estrogen or a progesterone component to it, it is a hormonal contraceptive. So the estrogen is the piece that stops ovulation, or should. The progesterone piece, and if you're on a progesterone only pill, we call them POPs, progesterone only pill, those only impact the uterus. There is a high likelihood that you're still going to ovulate if you're on a progesterone only pill. So that means that you can still fertilize an egg and a new life begins and starts moving its way down to the uterus, but it has nowhere to go. So when you menstruate, the baby will slough out with the rest of the endometrial tissue. So hormonal contraceptives are the big one, especially in the Catholic faith, that says absolutely not, because we believe in life and the value of life at the moment of conception. So if there's still any risk of ovulation, even though you might not get pregnant based on the definition of pregnancy that the ACOG changed in the 1960s. And if you don't know the information on that, go back and look at my other video. But they changed that definition in the 1960s. So you could still ovulate, but you're not pregnant, but you do still have life in you. So this is why especially the Catholic Church says no birth control, especially no hormonal contraceptives, because you don't know if you ovulated and then possibly lost your baby because you made that environment hostile to that zygote. So what are the risks? Like, what are the rates of ovulation? How often do you actually ovulate? Well, it depends. So some low dose estrogen pills, the really low estrogen oral contraceptives that have higher progesterone levels, those ovulation rates are significantly higher. They hit to like 30, 40, 50%. If you're on a low dose of estrogen, you ovulate 30, 40, 50% of the time. That means that there's a 30%, 50% chance of you conceiving a child, but you're not going to get pregnant because it doesn't have a chance to implant. Now, some of the higher dose estrogen pills that we have, their risk of ovulation is like 0.2%. It's very, very, very low. But again, it's not zero. There is still a chance that you conceive a child, don't even know it. It moves down the fallopian tube and has nowhere to go, and you slough it off at menses. That's the moral issue.